Hi, Dave from Hills Physiotherapy. Today we're going to look at the nerves in the lower leg. So we've had a look at what's coming off your arms, so your C6, C7 nerves. So today we will have a look at the mysterious sciatic nerve and its cousin, the femoral nerve, which runs through the front. So by the powers of medicine, we will show you what it does. So here we have a leg and a back. So your sciatic nerve starts up here. So it's about between your fourth, your fifth vertebrae and your sacrum, and it comes out the side, but it actually comes out with a whole lot of little different nerve roots, and they all combine together to form this big thick nerve. Now the rock tape here is about the thickness of my thumb, and that's about the actual thickness of your sciatic nerve. So it courses down through the muscles through the gluteals, and one of the muscles in there, piriformis, it can actually get quite close to, and that can sometimes irritate it. The sciatic nerve then courses down the back of the leg, back of your hamstrings. And this is sometimes when we've got people that have got chronic hamstring tears, we might have to do a bit of nerve work with them as well, because the nerve can get irritated down here. As it comes further down your thigh, it then splits into two. So as we're coming down here, this is your tibial nerve, so it runs down the back of your knee, all the way down the back of your calf, and it'll divide down here, and it'll even come out the outside of your Achilles. Further back up again, when it's dividing over here, it'll come out, and then it splits into two. So we get your deep fibular or perineal nerve and your more superficial perineal nerve. And that runs down the side of your leg, comes down to your ankle, and just down about here, quite often, you can actually, if you flick your finger backwards and forwards here, you'll feel like what's a little fishing line, and it'll give you a little ping or little zings. That's actually your nerve that's going in there. And sometimes with ankle sprains, especially if they've been a bit acute, if people are getting some pain coming down the outer aspect here and pins and needles and numbness, it may be because what they've done is not only sprain the ligament, but they might actually sprain the nerve as well, for instance. So that's your sciatic nerve. And if we now get our model to turn around, here's your femoral nerve. So your femoral nerve comes down the front. Bony point in front of your pelvis, these come off that. If you push in there, some people are a bit tickly, it can be a bit painful. That's your femoral nerve. It comes down your quads, just to the outside of the big thick muscle there, and then it branches into three. And the important one, or the interesting one down here, if you have a little feel around the side of your knee down here, you'll find your long saphenous nerve. And if you ping that, it's like a little fishing line, and again, that can give you a few zings and zaps when you go down. That's quite often irritated. Sometimes people have got osteoarthritic knees, and especially like people that have come out of having an arthroscopy on a meniscus. So that's your nerve anatomy. So I'll finish it there just now, and then what we'll do is we will have a look at some exercises for that later on today. Bye-bye.